Welcome to the Deep Dive. Today, we're tackling a really important topic, navigating in-home care services right here in Georgia.
That's right.
We've primarily used info from Health Force of Georgia to get a detailed picture,
hmm
looking at what's available, the types of support, and key things to think about if you or someone you care for is exploring this.
Exactly.
Our aim is really to cut through some of the complexity, give you a clear understanding of the options for, well, compassionate care at home.
Yeah, we looked closely at what Health Force of Georgia details on their site, plus some general info, just to
Yeah.
give a focused view of what this support looks like in Georgia.
Right.
We really want to highlight the essentials and maybe demystify the process a bit for anyone thinking about bringing care into the home.
Okay, let's unpack this then. One of the first things that really stands out is just the sheer range of compassionate home care services Health Force of Georgia lists.
It's quite broad.
Yeah, everything from home infusion therapy, companion care, personal care, skilled nursing, respite care for caregivers, even specialized Alzheimer's and dementia care, and something called GAPP care for children.
Hmm.
What does offering such a wide spectrum tell us about how care is changing?
Well, I think it shows the increasing ability to manage diverse, sometimes pretty complex health and personal needs without someone having to move to a facility.
Right, avoiding that disruption.
Exactly. It reflects a growing understanding of the value and, frankly, the comfort of getting care in your own familiar space. The variety suggests families have more tailored options than maybe they used to.
Absolutely. And it's reassuring to see they emphasize carefully screening caregivers.
That's
They
key.
talk about background checks, checking employment and health records, being bonded and insured.
Yeah.
For someone thinking about inviting a caregiver in, how crucial are these
Oh,
steps?
they're fundamental,
Yeah.
really, for peace of mind. When you're opening your home, knowing that person has been thoroughly vetted, it just builds that essential layer of trust and security
For everyone involved.
for everyone. And being bonded and insured adds that extra protection, if something unexpected happens.
Okay, let's dive into some specifics. Home infusion therapy is one service listed.
Mhm.
For someone maybe not familiar, what does that actually involve day to day?
So think of it as getting medication through an IV drip.
Okay.
But instead of going to a hospital or a clinic, it happens right in the comfort and privacy of your own home. It can be just as clinically effective, but potentially with less disruption to your daily life.
Now here's where it gets really interesting for me.
hmm
The list of infusion services they provide is, well, it's extensive.
It is.
Various IV brands like Bivigam, Gamate, other IV meds like antibiotics, fluids, Remicade, treatments for HAE, enzyme replacement therapies, hemophilia treatments.
Sub-Q, IG, IM injections.
Right. And they handle different IV types, peripheral, central lines. It sounds like a very high level of medical care can actually be managed at home now.
It really does. It signals a pretty significant shift in how healthcare can be delivered.
Yeah.
For people with chronic or complex conditions needing these therapies, getting them at home can just dramatically improve their quality of life. Fewer hospital visits, more normalcy,
Makes sense.
and the sheer variety listed really highlights the advancements in making sophisticated medical care accessible outside traditional settings.
Okay. Another service they highlight, and I think many families can relate to this one, is respite care.
Ah, yes. Very important.
Anyone who's been a primary caregiver knows the demands. What's the main purpose here?
Respite care is specifically designed to give family caregivers a break, a temporary breather from their responsibilities.
Essential, I imagine.
Absolutely essential for their own well-being. It lets them rest, recharge, which, ultimately benefits both the caregiver and the person they're caring for.
And it can cover things like companionship or helping with chores during that break.
Exactly. Whatever care is needed during that time, respite can cover it, whether it's companionship, homemaking, or even personal care.
Okay. Moving on to companion and homemaker care for seniors. This seems to address those everyday challenges that can pop up as people age but want to stay home.
Right.
How does this type of care make a difference?
Well, it provides two key things:
Yeah.
that valuable social connection, the companionship,
Mm-hmm.
and practical help with daily living activities. It can be really helpful for seniors living alone who might struggle with household tasks or maybe are at a higher risk of falls. It's all about supporting their independence and general well-being.
They even list some potential warning signs. I thought this was practical. Things like an unclean house, maybe unexplained scrapes, an empty fridge, or someone becoming more withdrawn.
Exactly. Those subtle clues, they aren't always dramatic, but they can signal that a loved one might be starting to need a bit more support.
Yep.
And the kinds of help mentioned shopping, cooking, errands, light housekeeping, laundry, just providing socialization, it shows how comprehensive it can be. It's more than just tasks. It's about, fostering a better quality of life.
Now, personal care services sound similar, but maybe they focus more directly on the person's, well, personal needs. How do they usually differ?
Yeah. Personal care often involves more hands-on assistance, things like bathing, dressing, grooming, maybe help with mobility, feeding, toileting, alongside things like meal prep and errands.
Got it.
The main goal is still enabling independence at home, safely and comfortably. And the fact that Health Force offers that free in-home assessment by an RN, that's a big plus for tailoring the support.
Right, creating that personalized plan you mentioned.
Exactly.
And again, that emphasis on caregiver, quality screening, background checks, drug tests, reference checks, ongoing RN supervision, it keeps coming up.
It does, and it should. It just underscores how vital trust and reliability are in this field. That RN oversight adds another layer of professional guidance, ensuring the care plan is right and well managed.
Okay. Now, for people with more significant medical needs, there's skilled nursing care. This sounds like it goes beyond basic personal care.
It does. Skilled nursing care is provided by licensed nurses, RNs, or LPNs in the home.
Okay.
This level is for individuals needing more complex medical attention. Think wound care, medication management, especially injections or IVs, ostomy care, continence care, maybe post-surgery recovery support.
So the benefit is getting that professional medical care, but at home.
Precisely. It often means more one-on-one attention compared to a facility setting, which can potentially speed up recovery. It includes that comprehensive clinical observation and assessment, all under RN supervision.
So this could genuinely be an alternative to a longer hospital stay or maybe going into a rehab facility for certain conditions.
For certain conditions, absolutely. It offers professional medical care in a less institutional, more comfortable environment. That one-on-one focus can be really beneficial.
Now, a particularly important area, and often a challenging one for families, is caring for people with Alzheimer's or other dementias at home. What specialized services do they offer here?
Right. Their services focus on providing caregivers who are specifically trained to understand and manage the unique challenges of memory impairment.
That training seems critical.
It is. The goal is always to help the individual maintain their dignity and as much independence as possible for as long as possible within those familiar home surroundings.
They also list some key signs of Alzheimer's, similar to the companion care warning signs, which could be helpful for families. Difficulty with familiar tasks, misplacing things often, recent memory loss, confusion, mood changes.
Recognizing those signs early is so important for getting the right support in place. And the information rightly highlights how crucial physical activity and social engagement are. They suggest things like gentle exercises, walks, gardening, even outings. These can make a huge positive difference to quality of life for someone with dementia.
And they offer options like Alzheimer's respite care again, so vital for family caregivers, and also 247 live-in care.
Those options acknowledge that the level of care needed can be really diverse and, frankly, often intensive.
It's a lot.
It is. And the statistics they mentioned from the Alzheimer's Association, over 5 million Americans living with it back in 2017, the health impact on caregivers, someone developing it every minute or so, it just underscores the huge need for these specialized services.
It's a stark reminder. And the point that the death rate from Alzheimer's in Georgia is reportedly higher than the national average. That really emphasizes the need for accessible, quality care here.
It really does. Highlights the critical need for robust, knowledgeable caregiving resources right here in Georgia.
Let's shift gears slightly to the financial side. Health Force of Georgia mentions Georgia waiver programs. What exactly are these? How do they help?
Okay, so these waiver programs are funded through Georgia Medicaid. Their main goal is to help eligible residents get necessary home health care services with little or potentially no out-of-pocket cost.
The goal being to keep people at home.
Exactly. To support elderly or disabled individuals so they can keep living in their own homes and communities, basically avoiding or delaying the need for institutional care, like a nursing home.
They specifically mention several programs. One is Structured Family Caregiving, or SFC. This sounds interesting. Family members can actually become paid caregivers.
Yes, that's right. The SFC program recognizes the huge role family members often play.
Right.
To be eligible, the caregiver usually needs to live with the person needing care and be a specific relative, like a spouse, adult child, etc. The program gives them financial compensation and support services.
That could be a significant help for many families.
Absolutely. They also list the Community Care Services Program waiver, CCSP, the Independent Care Waiver Program, ICWP. That one's for adults with severe physical disabilities or traumatic brain injuries, and the SOURCE waiver, providing in-home nursing and personal care.
So several different routes for financial help depending on the situation.
Exactly. Each has its own eligibility rules and offers different kinds of support. It's really important for families to look into which program might fit their specific needs best. The ICWP, for instance, reimburses directly for those with severe physical disabilities, or TBI, which is vital for those who qualify.
And now flipping the coin,
Yeah.
let's look at it from the caregiver's perspective. Health Force of Georgia talks about caregiver careers. What should someone thinking about this profession know?
Well, they frame it as an opportunity for compassionate people to really make a difference. They emphasize hiring carefully screened professionals, RNs, LPNs, CNAs, PCAs, and that rigorous hiring process we talked about. In-person interviews, checking credentials, extensive background checks for criminal history and elder abuse, drug testing, reference checks. It shows their commitment to quality hires.
And they mentioned benefits of being an employee, like workers' comp, being bonded, payroll, taxes handled. That seems like a plus compared to maybe being an independent contractor.
It's a significant advantage, yes. By employing caregivers directly, they provide a level of security and benefits that might not be there otherwise. It offers peace of mind for both the caregiver and the client family.
Right.
And the credentials they require, the CNA card, nursing license, CPR, negative TB test, proof of ID, and that 6 months recent CNA experience, it reflects the professional standards they maintain.
So pulling all this together, why might someone specifically choose Health Force of Georgia? What are their key selling points based on their info?
They highlight several things. First, being locally owned and managed in Atlanta. They mention the owners, Art and Elizabeth Bartlett, and over 100 years of combined senior healthcare experience. That local connection and depth of experience can build trust.
Yeah, that feels different than a big national chain sometimes.
It can. They also stress that they provide personalized care, saying they aren't a franchise offering, one-size-fits-all solutions. That commitment to understanding individual needs seems pretty central.
That personalization seems key.
It's a crucial differentiator, I think.
Hmm.
Getting care tailored to you likely leads to better outcomes and just greater satisfaction. Their service area covering Metro Atlanta and 18 surrounding counties shows a pretty wide reach, too.
And that free in-home assessment by an RN you mentioned earlier.
That's a valuable first step. Insurers' needs are thoroughly assessed before anything starts.
Plus, things like 24/7 availability with a local coordinator, providing supplemental staff to facilities, trying for consistent caregiver assignments to build relationships.
Right, those all contribute.
And importantly, accepting Georgia Medicaid and those waiver programs makes them accessible financially for more people.
Exactly. Taken together, it paints a picture of a comprehensive, locally rooted, quality-focused provider. The mix of experience, personalized care, payment accessibility, and round-the-clock support makes them a strong contender in their service area.
It's also useful, I think, to briefly touch on how in-home care stacks up against other options like assisted living or nursing homes. They mentioned these comparisons. What are the main takeaways?
Yeah, the comparison generally highlights that in-home care allows for the most independence and personalized care in a familiar setting. You
Yeah.
build that direct relationship with a caregiver.
Okay, but the cons.
Well, your home might need modifications.
Mhm.
Family might need to be more involved in managing care unless you use a comprehensive agency like this. And costs can go up if you need many, many hours of care.
Right. And assisted living or nursing homes. Quick pros and cons.
Assisted living can offer a good balance of independence and support, plus built-in social activities. But the medical care might be less intensive, and staff consistency can vary.
Mm-hmm.
Nursing homes are typically for those needing extensive medical care and 247 supervision. But they're usually the most expensive option and maybe offer less privacy or personal attention than home care. Both settings have more rules and structure compared to being at home.
Okay, that's a helpful overview. Finally, it's important we note they also provide information about COVID-19 safety,
Absolutely. Essential now.
emphasizing their commitment to patient and employee health. monitoring the situation, following official guidelines. That's become a major factor for people making care decisions.
Definitely. Their proactive stance, having protocols for caregivers on preventing infections spread it, shows they're aware of current health risks and committed to safety for everyone involved.
So to kind of wrap this up, we've explored the landscape of in-home care in Georgia, really looking through the lens of Health Force of Georgia's information. We've covered their wide range of services, the importance they place on qualified, screened caregivers, those Georgia waiver programs for affordability, and how home care compares to other options.
Yeah, and we've touched on the need to consider specific individual needs, whether it's complex medical care like infusion therapy, help with daily activities, or that specialized support for dementia. The constant theme seems to be quality, personalized care from professionals delivered at home.
Right. So our final thought for you listening is this. Really understanding the diverse needs out there and the different levels of support available from experienced providers like Health Force of Georgia, that knowledge can empower you. It helps you make informed decisions for yourself or for your loved ones. So maybe reflect on what specific aspects of getting care at home resonate most with your situation or your concerns right now. It's a really important question as you navigate these choices.
A very important question indeed.
Thanks for joining us for this deep dive.